Hello, my name is Jordan, and today I'm going to be discussing cardiovascular disease and illness, specifically among the Native American and Alaska Native populations. So first, I'm going to start by answering the question, what is cardiovascular disease? And as we can see here, cardiovascular disease can actually be shortened to CVD. So CVD is a blanket term for other conditions related to the diseases of the heart as well as blood vessel disorders. And down here at the bottom, we have some common examples of the conditions that fall under our blanket term, which include heart attacks, strokes, heart failure, as well as arrhythmias. And arrhythmias are quite simply known as irregular or unnatural heartbeats. So now that we have answered the question, what is cardiovascular disease, we are going to take a look at our focus populations of Native Americans and Alaska Natives and see that they are actually at higher risks for CVD. So when hearing this statement, there may be a follow-up question as to why. Well, first, Native Americans and Alaska Natives have higher rates of diabetes. In addition, when compared with whites, Native Americans and Alaska Natives had a higher percentage of obesity, high blood pressure, and physical inactivity. Lastly, those of these populations have a lower life expectancy and are disproportionately affected by chronic conditions. So overall, the factors mentioned here increases one's chances of getting cardiovascular disease. Therefore, since Native Americans and Alaska Natives have higher risks, like high diabetes rates, they have higher chances of getting CVD. So far we have only been discussing our broad term of cardiovascular disease, so we are going to focus more on one aspect of CVD. So this statement here was made by the U.S. Department of Health and Human Services, Office of Minority Health, and they stated that in 2018, American Indians and Alaska Natives were 50% more likely to be diagnosed with coronary heart disease than their white counterparts. So since we are now aware of this statement, we are going to focus more on coronary heart disease, which is also known as coronary artery disease. And as we see here, coronary heart disease is also known as coronary artery disease, and this can also be shortened to CAD. So CAD is damage to the heart's major blood vessels, and the damage that is done is usually caused by a blockage of plaque, which then causes a narrowing of the vessels. And typically this plaque that blocks the artery is made up of cholesterol deposits. And over here in this picture, we see that on the left, we have a normal artery, so there is no blockage and there is no restriction of blood flow. However, on the right, we do see that this yellow blockage, which is our plaque, causes more of a restriction and there is less blood flow. And some common symptoms that one may experience with CAD are shortness of breath, chest pain, and possibly a heart attack. Now, there are quite a few risk factors that cause one to get CAD. They can either be modifiable, meaning that you can make changes to your lifestyle to get rid of these risk factors, or non-modifiable, which means you cannot make changes. So on the left here, we have modifiable risk factors, which are unhealthy diets, lack of physical activity, excessive tobacco use and alcohol consumption, as well as obesity. And then on the right, we have our non-modifiable factors, which are age, gender, family history, as well as race. So now that we introduced cardiovascular disease and talked more about one aspect to this broad term, we are going to discuss why there is a need for education among the populations. First, as we discussed earlier, they do have higher risks of getting cardiovascular diseases, so it would be important to inform one of these populations of their risks. In addition, most do not receive good quality healthcare, which means that there is a possible lack of education and information. And lastly, there is a physical barrier that stops these populations from receiving care, and this physical barrier is the fact that some live in isolated reservations or areas, so long distance travels could block them from establishing with a primary physician, and they may not get the opportunity for regular checkups. So that is all I have for you today, and here are my references. Thank you so much.